Hello, my name is Alexis Brown, and I am a fourth year health science general major, and I'll be presenting to you Beyond AIDS Intervention Program. Okay, and here's a little background about HIV and AIDS. HIV is a human immunodeficiency virus that attacks the body's immune system. If HIV is not treated, it can lead to AIDS. As of today, there is no cure for HIV. Once a person has it, they have it for life. HIV in humans came from a type of chimpanzee in Central Africa. Studies have shown that HIV from chimpanzees to humans go as far back as the late 1800s. The chimpanzee version of HIV is called simian immunodeficiency virus. According to the CDC, HIV was probably passed to humans when humans hunted a chimpanzee for meat and came in contact with their infected blood. Okay, HIV and AIDS in Mozambique. The first case of HIV in Mozambique was reported in 1986. By 2001, 1 million people were estimated to be living with HIV, including 53,000 children under the age of 18 and 57,000 women. HIV is significant to the field of global health because HIV remains a major global health issue, having claimed so many lives and ongoing transmission. Mozambique is ranked the 8th most HIV-afflicted nation globally. So with that being said, HIV has affected Mozambique's country, population, and region by increasing the mortality rate in the country, causing the population to decrease and the region to be in an epidemic. Because of the impact that HIV and AIDS have on public health, it has become a major focus for global health, being that millions of people have died from HIV or AIDS-related causes. The burden of disease for Mozambique. According to data by the National AIDS Council, in 2022, Mozambique recorded at least 48,000 deaths caused by HIV or AIDS. In 2022, 2.4 million people in Mozambique were living with HIV and AIDS, and 98% of those people were adults. Black Africans, especially women, have the highest overall HIV prevalence compared to other race groups. Poverty is a factor that increases this disparity associated with HIV prevalence between genders and race groups created by historical current unequal cultural, social, and economic status in Africa. The HIV epidemic in Mozambique is the leading cause of death. Okay, and to the left of us, we have our chart here that shows us our overall population of Mozambique. So for 0 to 14 years, we have a 45% of a population for that age range. 15 to 64 years old, we have 52.1%, and for 65 years and older, there is 2.9%. And at our chart at the bottom right, we have our ethnic group percentages, and as you can see, Black Africans are the majority of the percent of the population for Mozambique. So Mozambique's birth rate is among the world's highest, averaging around 5 children per woman. The HIV epidemic disproportionately affects women compared to men, and is highest among Black African females. So as you can see on our chart again to the left, there are more females in the population between 15 and 64 years old. So around that age is our young adult and our adolescence, which starts to get into our sexual intercourse, and they start indulging into things which is causing unsafe sex practices, which also leads to HIV and AIDS. And the low socioeconomic status of women reinforce unequal gender power dynamics, which forces women into relationships that expose them to a higher risk of HIV than men do. Okay, now for this slide, we have 3 pie charts here. First, I'm going to go over the contributions to overall poverty. As you can see, there is 46.4% of the population in Mozambique that has a standard of living, and there's only 26.3% that have a good education. So when you think about it, those that are not very educated on safe sex end up transmitting the HIV to others, not knowing the benefits of using safe sex practices. As far as the population share of Mozambique, there is more than half of the population that is below the income poverty line, and there is 43% of the population in severe poverty. In the HIV and AIDS rates by age in Mozambique, women aged 15 and over are at 61% of the population, and there is men aged 15 and over that are at 32.9%. So this 6.1% of children aged 0 to 14 years old are most likely from women who are not aware that they are HIV positive and have given birth to their kids and transmitted it onto them. As far as the women aged 15 and over that are at 61%, around the age range of 15 is when adolescents and young adults tend to indulge into sexual activity and are not aware of the best safe sex practices to avoid being transmitted with HIV or AIDS. So evidence suggests that the Mozambican HIV epidemic is characterized by heterosexual infection, which is among the world's most severe health worker shortages, relatively poor knowledge of HIV/AIDS in the general population, and lagging access to HIV preventative and therapeutic services compared to other nations in South Africa. There are poor education system and high levels of poverty. The high population growth rate is somewhat restrained by the country's high HIV and AIDS and overall mortality rates. Black African women in particular are the most vulnerable than any other group to the social, health, and economic burden of HIV. And here we have our chart here that discusses our death rate due to HIV and AIDS. So in 2022, the women aged 15 and older have the most death rates, have the highest death rates in Mozambique due to HIV and AIDS. Between 2019 and 2021, HIV and AIDS continues to be the disease that kills the most in the country. In 2022, there were 48,000 people who died from HIV/AIDS related complications in Mozambique. Women in Mozambique have the highest rates of HIV than men and children. This has caused the mortality rates for women to be higher than men and children also. Okay, the intervention program that I created to help decrease things related to HIV and AIDS in Mozambique is called Beyond AIDS Intervention Program. Our motto is United Against AIDS and Together for Health. So our mission is to educate individuals about HIV prevention, help prevent HIV infections, and reduce HIV-related illnesses and deaths. Our goal is to reduce HIV rates in Mozambique by 90% and reduce the mortality rate by 50% by 2030. Our objective is to diagnose, treat, prevent, and respond. Doing those things, we plan to prevent new HIV transmissions using interventions and to treat people who are infected with HIV quickly and efficiently. So, doing all those things, our outcome would be the majority of the population should know their health status, and those who know their health status should be on treatment, and those on treatment should be continuing their treatment. Mortality rates from HIV and AIDS should decrease by more than 50% once our program is implemented. So, by educating adolescents on the importance of safe sex and substance abuse, we can help minimize the rates of adolescents who are infected with HIV and AIDS. Adolescence is the period when most people initiate sexual activity. Adolescents and young adults face risk of engaging in alcohol and drug use that can also lead to unsafe sexual practices and the transmission of HIV. Due to the economic status of Mozambique, some ways we can help prevent HIV will be sexual health education, relevant health services, and supportive social and economic environments to help reduce their vulnerability with HIV infection and strengthen their skills for protection. Okay, a program I will collaborate with to help reduce and prevent HIV and AIDS would be the Southern Africa Regional Health Program. They work with PEPFAR, which is the U.S. President's Emergency Plan for AIDS Relief, across the sub-Saharan African countries to mitigate the impact of HIV or AIDS epidemic and improve health outcomes for Southern Africans. In Mozambique, PEPFAR focuses on HIV counseling and testing, adult and pediatric HIV treatment, prevention of mother-to-child transmission of HIV, and laboratory health services. We will work with this program to reduce the incidence of new infections among women and the incidence of HIV infections among adolescents and young women. We will also help reduce the number of deaths due to HIV and AIDS. Okay, and as an HIV intervention program, things we will recommend are free large-scale antiretroviral treatment through the public health system, HIV testing, access to condoms and sterile syringes, prevention programs for people living with HIV, prevention programs for people who are at risk, substance abuse treatment, education about risk and drug adherence, and strengthening of the healthcare system. HIV and AIDS in Mozambique deserves attention because there are individuals living in this area who need guidance and support to better their health. The poverty rates are so high that it is hard for them to increase their mortality rates on their own. The significance of improving global health in Mozambique is extremely important. Being able to help individuals practice safe sex and substance abuse and educate them on living safely can help them and possibly decrease their mortality rates. Being that HIV and AIDS is the leading cause of death in Mozambique, it is extremely important to implement ways to help decrease these rates. With women and adolescents being the most infected, there should be safe sex programs to help assist them. Getting everyone tested and treating quickly and effectively can help this epidemic get under control so that the spread of the virus is not as broad. From researching this topic, I have learned that not every country can handle challenges the same. A country's economic status plays a major role in the way a situation has to be taken care of. Future innovations should focus on the practice of safe sex. Because the fertility rate in Mozambique is so high, focusing on women and adolescent girls will give them a head start on staying on top of HIV and AIDS transmissions. Okay, and here are my references. Thank you so much, and I hope you have a great day.